So first of all, thanks, and I have this incredible tension knowing that this is hour 15 for most of your time, but really realizing that I think right now this is where we're getting to the discussion where it needs to be. What I'd like to do is just give a couple minutes of some of the take-homes I've had, and then reflect on what our plan is within Health Partners, and then offer an invitation in terms of how we can continue these discussions. So some of the themes I've heard is it's not only about the head, it's about the head and the heart, and how you communicate is important. That the team of the future is not going to be in a binary mode, but I think that tension will be there. I think it's going to move away from the transaction to the relationship built on trust. A relationship is two experiences and both parties having some commonality on that. I would say education is going to be a relational issue. It's going to be more about dialogue, dialogus, two meanings of one thing rather than discussion, which is percussion, which is concussion, which is one person giving this transaction of the one truth that the other person needs to accept and all that. So I think it's going to be an incredible, exciting time. I think just, again, I can't tell you how grateful I am all the people that are coming here to do that. So what we've done just structurally at Health Partners is, because we hear the capacity issues and we also know our limitations of not having a systematic approach, is that we're undergoing this design process. So we have 4 working groups. One is a people working group where we're actually looking at who we should be training, how many, how, and what the reflection of our workforce model on it is. The other one is we're moving away from core competencies to practice-ready competencies. What are common practice-ready competencies that are going to be having? And maybe focusing the word away from team to teaming behavior. So Amy Edmondson is someone that writes a lot about teaming behaviors, being able to ask a question, try a new idea, and reflect on that, and have that continuously do that. Patient and family-centered care. I was just looking at a text yesterday. So I'm a former residency director. 10 or 15 years ago, you have former residents, calling you or texting you if they've done something really great. And in emergency medicine, it usually has been, I've done this thoracotomy and I saved a life, or this cricothyrotomy. So I have a colleague, Pat Holland, I think some of you know, got a text from him 3 days ago. He says, hey, I'm getting this award because I got 99% on Pres Ganey. And if you ever need someone to teach, and for those of you who knew Pat Holland, I'm not sure that's something that he was even in his mindset a few years ago. So I think it's the humanistic qualities of caregivers. I want to thank you all. I don't know when the museum is closed, but I don't know if Mr. Awesome left or if you've been to the Frankenstein part of that, but feel free to linger or look at some of the booths. Thank you very much.